Applying for LEED certification is one of the more complicated sets of decisions to make because you have to pay extra money. And in my previous role at Kaiser, are you going to pay $90,000 per facility to go through the certification process? And do you really want some of the things that get you points? You know, is it really that important to do exactly what gets you points in LEED certification, or do you want to do something else that you think is a good idea even if it doesn't get you points?
In our system, one of the things we look at is we build LEED certifiable buildings. We don't necessarily go for the certification, but we take the principles into account for our projects. It's difficult to justify the additional 1% to a project cost when we're cutting projects elsewhere.
I believed it was a good idea to go once through the process to see what we could learn and how we could change our standards for doing that. And actually we were in the process when I left of pursuing green building for one of our our hospital replacement projects. But otherwise I think just applying the standard makes economic sense if you're in a program with scale.
2 years ago we opened the Dell Children's Medical Center of Central Texas. It was the first LEED Platinum hospital in the world. We really jumped in with both feet.
Hospitals have been asked a question a lot about should they pursue LEED certification. So at HCA, right now we're discussing that through our sustainability steering committee is what do we want to do as far as sustainability in healthcare as it relates to design and construction and LEED certification.
To me it's a good thing. If you're building a healthy building, it's good for the guys that are building the building. They're not spraying paints that have high VOCs and they're not using solvents. So it's a healthy building to build and you know, what could be better to have a healthy building in a place of healing?
At this point in time, we do not have a LEED certified hospital. We are looking at for some of our future projects, but for right now, I think we are looking to see how healthcare standards are being developed specific to LEED, which are still under development. Those are not at a point yet that are specific to healthcare, but within the next coming months, those will be more specific to how to apply LEED to healthcare. So right now, we're just using sustainable practices and then reviewing the new standards when they come out.
There is a standard called the Green Guide for Healthcare, and it has a certification process that's a self-certification process. So rather than going out and getting the plaque on the wall, you basically still state that you've done these things, you've commissioned your building in order to achieve a certain level of physical sustainability in your building.
But we're not pursuing LEED simply as a goal. It will be a byproduct of our sustainability initiatives and simply a measurement tool to understand how effective we've become.
We're all citizens of this earth and we have limited resources, and so we should basically be good stewards. Do I care about a plaque? No, I don't care about the LEED certification per se. Do I care about being sustainable and being responsible in our actions? Absolutely.
You can always make good decisions about lighting controls and water controls and things like that. You might not need to get certified, but I think having that overlay of sustainability is the way things are going to be in the future.